My name is Ishwar Taylor. I'm the president of the Gujarat Hindu Society. I'm going to explain to you a little bit about the partnership we formed with the National Health Service in delivering some of the services that was required by the Hindu community in particular, and also how this partnership has developed over the last 10 years, and we're approaching the 10th anniversary, which is going to be celebrated next year. When we developed the new center, it was realized that we needed some professionals to guide us through the health issues that were being faced by the Asian community, the wider Asian community, but also by the Hindu community. And as this center has been developed, we made sure that we made our community doctors aware that this facility was available for them, but we wanted them to engage so that we could sort of have some professionals who could guide the community towards better health. Initially, our meetings took place with some health professionals and members from the NHS and also from the Lancashire teaching hospitals, who were very supportive, and we did it on a pilot that we would try it for the first year. And the idea was that they would sort of form a small steering group, which is now called the Lancashire Gujarat Health Users Forum, and that steering group included members of the community, and it also had members of the management committee to oversee and facilitate and make sure that the projects was delivered properly. There were two emphases. We made sure that the steering group were quite clear that we needed to make sure that the program was in bilingual, so that our members could understand, and secondly, bringing awareness, not just bringing awareness, but also taking some positive actions through either health programs or through yoga and various other exercises. So I think over the years we have been able to develop this partnership as a strong partnership, which is now recognized by the Department of Health. The type of partnership we've created is non-threatening, and at the same time we have not compromised our culture or our values, but in fact we have enhanced our members to live a more healthier life. Vishal, can I ask you, in the sense that since you joined the center and also playing a part with the holistic living, can you just explain a little bit how that had to happen and the progress you made to date?
When I came over here, I saw the elderly people who were having kind of complications and things like that. They were not able to talk to doctors, is to explain their conditions and things like that. And I initially started with the elderly people, and then slowly what we do in holistic is that understand what kind of discomforts that we are suffering, what our body is suffering, is it related to our mind, is it related to our emotions. And once you realize that, you know yourself. In fact, in our religion, as I mentioned to you, the Gita is one of the holy books which says that you should know yourself before you can know others. So, and if you know yourself, then you can take responsibility about your health and start working towards curing yourself or having a long cure. And for that reasons, like Ishwar mentioned, that the Lancashire Health Users Forum, we have seminars once a month, and various doctors from various faculties, they come down, and it's in bilingual. It is presented to about 60 to 80 to 100 people, and this takes place every month, and that is followed by a community lunch that anybody is welcome, wider community of people come in. The other thing what we do is kind of the health mailer. It's a place for, again, a wider community. There's so many people from social and the social service, as well as the medical companies, corporate people, they take part in it. I think last year we had something 80 to 100 stalls displaying various kind of support and things like that. You know, people came, there was a section where people got their health checked, and blood pressure, diabetes, cholesterol, all of. With this holistic living course, more and more young people have started joining in, so that the message is passed across to the wider community, and they're promote. You know, we see the health being promoted, and as I said, that this is all the organization is doing a seva. Seva is a kind of, we do not expect anything out of other people, and that's why nothing threatening to each other. Like when we work with any organization like National Health, or we work with any social services in Preston, anywhere, they know that we are all volunteers here, and we come together for the benefit and for the community.
There's also one thing I'd like to mention is that we have Professor Gupta, who is our chairman for the Lancashire Gujarat Health Users Forum. He's a physician himself, he's a doctor himself, but he's also involved at national level with the Department of Health to tackle the issues the ethnic minority people face in terms of diabetes, heart attacks, and also high cholesterol levels. So I think what we have captured in this partnership is not only about creating awareness, but we've also created a center where we have yoga classes, we have the holistic living, we have WD-40 exercises, and there's also other activities that take place. This is a partnership with the health service, but we also have a partnership with the education department, where with Lancashire Adult Learning, who are also very actively engaged. We're developing partnership with other partners. We are part of the Interfaith Forum in the sense that we take part in Lancashire Forum of Faiths, we're involved with Preston Faith Forums, and at national level we're also involved with Hindu Forum of Britain and various other organizations. So I think what we've done in Preston, especially through the centre, is that we've created networks and also good practices. So this particular partnership is a role model for other towns. We've been able to influence Chorley, Bolton, Oldham, Manchester to organize such things with their local NHS. We're getting a small amount of funding, but the awards are huge because it's not only benefiting the NHS, but it's benefiting the local community, and it's recognized by all the health professionals who come here and who value the amount of effort and the effort that's put in by the community as volunteers, because to organize anything like a huge mela is a big affair, but with the community based here, I think this is a true way to go forward for partnerships.